Welcome, welcome. Thank you so much for joining us for this public panel. This is the first time in a while that we've done one of these, and we're really excited that you have joined us. This panel is part of our ongoing education series on self-managed abortion, and today we are joined by four incredible panelists to support us in growing our knowledge and understanding of self-managed abortion. I'll first introduce myself. Hi, my name's Amanda. I use she, her pronouns, and I'm the movement building director at the National Network of Abortion Funds, and we are hosting this panel. I want to first sort of get us oriented to what we're going to be doing today. I think I need next slide. We're in the midst of the welcome right now, where we will be doing introductions and a little bit of grounding in language justice and gender justice. We will introduce the panelists and then we will go ahead and dive right into our panel discussions. We have some preset questions, and then after we've answered those questions, then we will open it up to you all using the Q&A feature down at the bottom of your window, your Zoom window. You should see a Q&A with a little like question mark next to it. And then are going to close with a couple of next steps and some reminders. So that's what we'll be up to today. And we're hoping that you leave today with some shared knowledge about SMA in its historical and current political context, and understand some of the like sites and methods of criminalization for folks who want to manage their own abortion, and then understanding the impact of abortion criminalization on both individuals and communities. Um, so for right now, I'm going to pass it over to our wonderful interpreters who are supporting us with interpretation from English to Spanish.
Thank you so much, Amanda. These are the instructions to connect into the Spanish language interpretation. It will be set up in a couple of moments. It will be located at the bottom. So if you want to listen in Spanish, you can find that logo. It will look like a globe, and then you can click where it says Spanish and you'll be able to hear the Spanish simultaneous interpretation. If you're connecting from a cell phone, it is located at the bottom right. Look for three dots that say more, then click there, then click language interpretation, and then you can click in Spanish and then click on done at the top right. Para conectarse a la línea en español, en estos momentos no está activado, pero va a estar activado en unos momentitos. Entonces van a ver un globo terráqueo. Si no lo encuentran, busquen tres puntos que dice más o more, opriman ahí y luego opriman español y luego toquen finalizado arriba a la derecha. Thank you so much. Over to you. We are ready.
Great. Thank you all so much for supporting us in our multilingual space, which we really value in the work that we do here. Okay, some additional notes on accessibility. There will be live captioning. So if you need to access that, there is a button down at the bottom of your window that says show captions. It'll say CC on it. And I believe that's it on our orientation to accessibility. Okay, could we go to the next slide? Okay, and then I named that there's a Q&A feature down at the bottom of your window. If you have a question that you want to ask the panelists, please add it to that Q&A list. We likely will not be able to answer all of the questions, but some folks on my team are going through and screening the questions, and we'll choose some for our panelists to answer. All right. So the last note that I really want to make to you all is just a note around the gender inclusive language that we use at NNAF. At NNAF and most abortion funds, we use gender inclusive language to refer to people seeking abortions and pregnant people. So instead of saying a woman trying to get an abortion or a pregnant woman, we say a person trying to get an abortion or a pregnant person. Not just cis women are people who have abortions. There is an expansive gender, are people of expansive genders are also having abortions as well. And so we want to name that and honor that experience by degendering our language and making everything a little bit more representative of the actual experiences and the actual people who have abortions. Okay. And I think um, into the next slide, great. And then there's some resources that we can pop in the chat for folks who are interested in more about language justice. All right. All right, so let's go ahead and meet our panelists. I am going to hand it over to them, and you all see your names on the screen, so you can move in that order to introduce yourself. So if you will just share your name, your pronouns, and the organization that you are representing. Let me start
Hello.
with Kanai.
Hello, I'm Kanaya. I use she, her pronouns, and I am the abortion support program manager at Advocates for Youth.
Hi, my name's Phoebe. I use she, her pronouns, and I'm a co-executive director of the Repro Care Helpline.
Hi everyone, I'm Naran. I use she, her pronouns. I am Senior Helpline Counsel at If When How on the Repro Legal Helpline.
Hi, everyone. My name is Caitlin Gertz. My pronouns are she, her. I'm the Vice President for Research at IBIS Reproductive.
Great. Thank you all so much for being here. We're actually just going to go ahead and dive right into these questions. And we can stop our screen share as well. All right. So the first question I have for you all is sort of like a foundational question. So what is self-managed abortion and how does your work touch or support people's access to self-managed abortion? And we're going to start with Phoebe.
Great, thanks all. So for us, self-managed abortion is going to encompass any abortion that happens outside of like the formal US medical system where someone lives. And that experience can look a lot of different ways. Some people might interact with the formal medical system a little bit, some people not at all. But we, no matter how someone is accessing their abortion at the Repro Care Helpline, offer peer support comprehensively throughout the entire process. And so a lot of people who call us are accessing their abortion care fully remotely. That might mean getting pills in the mail or some other way, but most people who call us are having or considering a medication abortion. And our doulas offer support throughout the entire process with both emotional support and answering questions about logistics and navigation. The landscape can be really, really complicated for abortion in general and self-managed abortion especially. So just having accurate, non-judgmental information sharing is a big priority for us. We answer questions and are there to talk with folks throughout the entire process. We're not doctors, we're not lawyers, but even from that peer support lens, which we think is really valuable and important, we're able to support people with almost any question that comes up during the process. And we often don't distinguish between if someone is having a medication abortion from a clinic or self-managed. Often people have similar support needs and questions, and we're there to help regardless.
Yeah, and here at Advocates for Youth, we have a similar definition to what Phoebe said, abortion outside of the typical medical system, and that can include with medication, the medication regimen with pills, that can include through abortion massage or manual extractions or the oral route. And what we do at Advocates is a lot of our work is with young people between the ages of 14 and 24. So through our Youth Abortion Support Collective, we have SMA info shares that allow young people to get trained on what self-managed abortion looks like, especially through the pill route. And then we also offer abortion support trainings throughout the year. And our abortion support trainings include a portion dedicated to a self-managed abortion. And through that training, we acknowledge the history, honoring the Brazilians who used miso for abortions when it was sold without a prescription, and also honoring Indigenous communities who used the herbal method.
Also at If When How, we think of abortion and SMA in very similar ways as Phoebe and Kanaya noted. And I also just want to add that SMA is as old as pregnancy itself. And with new medical technologies, safe abortion outside of a clinic has become much more accessible and widespread and safe. And with all of these resources, people have more access to information to make the best decisions for themselves. So at If When How on the Repro Legal Helpline, we're a national helpline that is available to support anyone who has questions about legal risk around self-managed abortion, whether they have questions about traveling, crossing borders with abortion pills, supporting someone in their life and wanting to give them abortion pills, navigating, supporting a young person who may not be able to involve a parent and wants to know, what ways they can access abortion pills, and just wanting to be a resource, a legal resource for anyone who has some of these fears or is, trying to make a really difficult decision, and also referring them to some of the amazing organizations that panelists here work at for additional support, practical support, and just being in a wraparound service where people can go when they need help.
Very much in alignment with what my co-panelists have said. When we think about self-managed abortion at IBIS, we think about any action that someone takes to end a pregnancy without clinical supervision. And then we very clearly distinguish between self-managed abortion broadly and self-managed abortion with medications. And I think that is incredibly important, acknowledging the history of self-managed abortion and the many ways that people have ended their pregnancies throughout history, and thinking as well about the technologic innovations in medications that have both made, as my co-panelists have said, the self-managed abortion more accessible and safer around the globe, and is now, in fact, recommended by the WHO as one of the safe and effective models of care for abortion, which is a change that happened in 2022, really based on a lot of research that has been done by grassroots organizations, accompaniment groups on the ground in countries around the world in collaboration with researchers. So at IBIS Reproductive Health, we are a global research organization, and we work with partners in more than 30 countries to conduct high quality research that positively impacts people's sexual and reproductive health and lives. And when it comes to self-managed abortion, we have worked with accompaniment groups and clinicians and advocates really all around the world to generate an evidence base that has demonstrated definitively that self-managed abortion with accompaniment support, which is essentially non-clinically trained doulas who provide information and sort of wraparound care, is no less effective than clinician-managed abortion. We have also documented evidence of the safety and effectiveness of self-managed medication abortion later in pregnancy, which is something we know happens globally and also here in the US. And I just wanted to lift up something that Phoebe mentioned in terms of how we think about the term self-managed abortion. I think especially right now in the US, as things are changing pretty dramatically in terms of the abortion access landscape, what people themselves think of as self-managed abortion and what we as a field have thought of as self-managed abortion is a little bit fluid right now. And I think it's really important that we both acknowledge that whatever words people use to describe their abortion experience are valid. And medication abortion is the same, whether or not you got it from a clinician or you got it from a dear friend. And so just thinking about how we define terminology and how we think about self-managed abortion, I do really think that it's critical to consider the legal risk. And we know that self-managed abortion is safe. We know that it is effective, as is medication abortion, regardless of how you get it. We know that people interact with the formal healthcare system at various points in time in their abortion, whether or not they are self-managing. But one of the core differences for folks who are self-managing, depending on a host of things, including their identities and their geography, is the legal risk that they may face if they are using medications outside of formal healthcare systems, or doing anything to terminate their pregnancies outside of formal healthcare systems.
Thank you all for sharing your orientation to the work to self-managed abortion. And Caitlin, you actually got us sort of started on the next question, talking about terminology. And I'm wondering how the narratives and attitudes towards self-managed abortion have shifted, let's say, over the last 10 years, and maybe even zooming in on post-Dobbs. Phoebe, if you want to start us off.
Yeah, absolutely. So one thing that's been really positive, I think, in the last 10 years, especially amongst folks like here who are on this panel and here as attendees, folks who care about access to abortion and reproductive rights and reproductive justice, I think there's just been a huge jump in awareness amongst people that this is even an option and that it can be a good option. And not only is it not necessarily like risky, it's not even necessarily a last choice. Like this can be a good way to have an abortion. But more than anything, we're just seeing in terms of our callers, more and more awareness that this even exists as an option. I think a lot of people for a long time have been told like the only way to have a safe abortion is in a clinic. And I think more and more people are over time, especially as more people have safe self-managed abortions and large numbers of people have safe self-managed abortions, more and more people know that this can be a safe and effective option. And it doesn't have to be the sort of like coat hanger narrative that has been put forward in a lot of times in the past.
What we're seeing at Advocates for Youth, especially across the young people that we work with, is there's a lot of young people that are looking to get educated on self-managed abortion. A lot of young people that are coming from different backgrounds that have heard some misconceptions about self-managed abortion being unsafe, misconceptions about self-managed abortion impacting fertility. And a lot of young people that are coming to us are looking for education and ways to combat those misconceptions and ways to combat stigma. Especially since we serve young people across the country. And especially when young people are coming to us hearing that some politicians are saying and wanting to make it illegal to provide information around self-managed abortion and attempting to ban speech around abortion. There's a lot of young people that we have worked with and sent educational resources that were wanting to learn more about self-managed abortion after HB 7 in Texas, which limits access to medication abortion through restricting the manufacture, prescription, distribution of abortion-inducing drugs in Texas and out of state. So once HB 7 was introduced, a lot of young people started coming to us to try to find resources and ways to combat some of the misconceptions that were happening in their areas, and also ways to distribute resources on campuses, and even doing medication abortion campaigns on college campuses, so that more young people have access to medication abortion. And then we've also been working with organizers in South Carolina that are looking to organize against SB 323, which was proposed in South Carolina, and that could penalize and criminalize those involved with abortion, including self-managed abortion. So a lot of the young people that we're working with are trying trying to find ways and avenues that they can work with people in their community and also be abortion support people to those in their communities, whether that's through supporting someone through self-managed abortion or that's through clinical, the more procedural abortions as well. But what we're seeing is more young people coming to us to try to find resources on addressing that misconceptions and stigma that's taking place in a lot of places across the country.
Yeah, and I think generally there's like on a very basic level, it feels like there has been a lot more awareness around SMA, especially with increased availability of medication abortion post-COVID and post-Dobbs. And I think as stigma like deepens again amongst antis, we also see that there's a lot more awareness around how people choose to self-manage their own care in many different ways. And I think even on the helpline, we really don't hear the phrase self-managed abortion anymore. It doesn't feel like people are even distinguishing between the source of the pills as much as they are instead thinking about the mode of access, so mail versus location at home. So it's really become about how people are accessing the pills and less about where it's coming from or that it's not coming from a clinical provider, a medical provider. And what we also know and see is that people are willing to take these legal risks because there's so much more information and legal support and emotional and practical support out there. And I think that this has helped reduce stigma and confusion, which has, as a result, helped reduce fear. So that always feels very like hopeful for me that I think even as we see so much stigma deepen amongst antis and in these horrible policies like HB7 or different ways of criminalization, we also know that people in the repro world are like showing up and really providing the tangible support in all different ways that people need and people are still accessing and self-managing their abortions.
I think I'll add just a little bit of a global perspective in terms of how the narrative has changed and shifted. And I mentioned so much of the research and action that has been taken over many decades by colleagues, accompaniment groups around the globe, really who, developed a sort of wraparound care model that helped to support people who were self-managing also in very restrictive legal contexts. And I think the evidence that was generated around the safety and effectiveness of self-managed abortion really was one of the things that enabled us as a global movement to start talking about the medications as safe and effective, no matter where it came from. And I think that that has been incredibly transformative in terms of our ability as global movements to talk about taking back really what was something that was originally discovered by feminists and activists in Brazil and then sort of got reabsorbed into the medical system and thinking about what it means, what the terminology self-managed abortion means, what the politics behind it are in terms of bodily autonomy and fight for liberation globally. And I do think that having that data and the change in the WHO guidelines really enabled some of that shift in attitude and narrative. And I think the power of really thinking about taking this action, regardless of whether or not governments are abdicating their responsibility for providing basic health care, and having really rigorous clinical and epidemiologic evidence to back it up, has really enabled us to change and shift some of the way we think and talk about it.
Yeah, for sure, for sure. And you all have already like started to talk a little bit about the impact or the means of criminalization, because as we know, shifting attitudes can translate to shifting legislation, which means more and more people are being pulled into the web of criminalization because of their abortions or because of the political context of their abortions. And so I'm wanting to dig a little bit deeper into criminalization, wondering what impacts you all see as a result of increasing criminalization of abortion at large, but even more zooming in on self-managed abortion and abortion with pills, and other pregnancy outcomes. They all sort of get criminalized in similar ways. What are the impacts on individuals and families and communities? And who do you see as being the most vulnerable to the impacts of SMA and abortion pill criminalization?
Yeah, I can start with this one. I think I'll start with the bad and maybe end on the good, which is that, one of the, I would say, worst impacts is seeing often from the sort of fear and cowardice of like hospitals and these other institutions responding to these really restrictive bans and widespread growing stigma towards abortion, denying people needed care, whether that's someone who was self-managing an abortion or is having a miscarriage or otherwise. There's a lot of justified fear from our callers and from broader communities that hospitals won't give them the medical treatment that they need. Um, and that is both from the actual like laws and criminalization, but also from the increased stigma and like general sense that abortion is like illegal or wrong, almost regardless of what the laws say, and that can have really serious impacts on people going through their pregnancy or ending their pregnancy in like a variety of ways, not just through self-managed abortion, but definitely especially in that case. I think other folks here will be able to talk well about who in general is most vulnerable to the impact of SMA criminalization, but one thing I can talk about is in supporting our callers who are in domestic violence situations and people who are under a lot of surveillance in their own homes. That can be a really vulnerable position to be in. And also, self-managed abortion is often the best option for someone navigating those situations where they're under surveillance or in an abusive relationship in their own home. And I guess like the positive notes I'll end on is like even very vulnerable people are having safe self-managed abortions every single day with support, and giving that support and shoring up our communities where there's as many support resources as possible can help people navigate these things, avoid institutions where they might be criminalized, avoid an unnecessary trip to the ER where there's like a snitch nurse. And like people can do this safely. And the upside of this increased like criminalization and publicity of that is just that more people know about abortion pills. So for every like negative news story out there that's scary and scares people and makes everything feel really confusing, there's also now more people who said, wait, you can get abortion pills in the mail? Wait, you can end your pregnancy like that? And so in some ways, as the environment gets worse and more stigmatizing, it's still spreading awareness and more people are finding out that they can end their pregnancies this way.
And ditto to everything that Phoebe just said, in terms of the most vulnerable individuals that we're seeing that are impacted by SMA and abortion pill criminalization. Because we work with young people between the ages 14 and 24, we are seeing, and a lot of them are coming to us on being nervous and scared about the fear of criminalization, being nervous and scared about sharing information and resources to people on campuses, people in their community, and then even like having abortion experiences themselves and what that looks like and how to support someone through an abortion when they have this fear of criminalization. So there's this fear of accessing care, and fear of ways to support themselves if they're thinking of going through an abortion, but also support people in their community. And as a result, there's people and young people that we work with that are finding alternative ways to do this work, and they're looking to historical practices. They're emphasizing digital safety, and what digital safety looks like while doing this work, while organizing, looking at different ways to communicate, looking at language and terminology to use, figuring out what not to share online and via social media because of this fear of criminalization, and also to protect their own digital safety. Thinking through like how they share information and how they're distributing resources, especially since we work with a lot of college students. So thinking through if they're going to share resources on a college campus, or if they're going to work with a local organization or a local cafe that can support them in distributing resources to people. If they're looking at working with an organization that can come in and do and lead trainings on digital safety and what abortion policies and laws are looking like across the country. We're seeing a lot of that as well. But we have been seeing a lot of fear and nervousness, but as a result, it has led to a lot of young people coming together and asking questions and trying to find out more information, and looking to other people within their communities that do this work, whether that's looking at reproductive justice organizations, or looking at abortion access organizations, or connecting with abortion funds or abortion clinics to get information, or even volunteering with different funds and clinics as ways to combat some of the misinformation and combat some of like the nervousness in sharing information and looking at how different organizations are doing that. But because we work with a lot of young people, we are tending to see that they are very vulnerable, especially when we're thinking about parental consent and judicial bypass and the laws and policies in different states.
I also want to add that I think as we see medication abortion get safer and more widely accessible, what we also see is punitive state responses that pose a significant threat to people who choose to end their own pregnancies. And we also know that criminalization is discriminatory, it's discretionary, and it's completely circumstantial. So it's often at the discretion of what police or prosecutors or ER doctors or nurses or social workers or CPS workers. So much of it is rooted in what they deem a quote unquote crime or okay or acceptable. And then it's circumstantial because it entirely is based on what they think or perceive as fetal remains or a medical emergency or someone who's experiencing IPV or violence. And this stigma furthers that criminalization. And like we've all said, the fact that it's the most vulnerable people that continue to be criminalized. So, for example, we've seen on the helpline a parent who chooses to support their child in accessing abortion care has had CPS called on them by a relative who didn't like that they were helping their child get an abortion. And as a way to punish this parent and the young person, they called CPS. And maybe ultimately, like it doesn't result in the fact that this is not a crime, and self-managing your own abortion is not a crime, but CPS intervention is still criminalization. It is still so disruptive to people's lives. We also see now there's so much fear around traveling or going to a hospital for immigrants or undocumented people just because of who they'll have to interact with at a hospital or the information that they have to share, or if medical provider isn't going to believe what they have to say and then call in a police officer, a social worker. Like these are all really intense fears that people have. Another example that we've seen is people who are on probation. The fact that they are under this government surveillance and control means that they have limited access and ability to travel. They also may not want to share with law enforcement agencies what their medical needs are. But again, people who reside in states where abortion is banned or where there's very restrictive laws around accessing abortion, they may have to like really navigate these difficult situations with law enforcement and of course people who are incarcerated. Like the hoops that they have to go through just to get the medical care that they need is wild. So we see how the most vulnerable people are experiencing this criminalization and the ways that different forms of control and surveillance impact communities, but it's all coming from the government and it's all rooted in state intervention and violence.
I'm just sitting with everything that was just said, and I want to tie a couple of things together. I mean, I loved, Phoebe, that you ended with an offering of sort of just the very fact of so much conversation around SMA and abortion broadly, and abortion laws sort of being a facilitator for knowledge about abortion pills. And I think coupled with what Ron was just talking about in terms of state intervention, there's this intersection where more people know, and potentially more people have the option of accessing medications and having safe, physically safe, self-managed abortions. And I think the chilling effect and the potential for criminalization is not something that we as a field have fully wrapped our heads around. And I mean, all of the different kinds of state violence that you just heard about has an impact on people and on communities, no matter whether or not there is better access to medications. And so I think there's this tension right now where it is, that we have always said pills have legs. This is not going back into a clinic setting. That reality is over. And so there is something hopeful about the idea that people know how to use pills and have information. But I think making sure that they have as much information as possible and as much support around them as possible to prevent or to help keep at bay those many different kinds of violence that the state can inflict on people having abortions, on the people who seek to help them and support them, on their communities. And we've sort of named this tangentially, but I do really think it's important to talk about surveillance and digital surveillance, and the fact that so many of the communities who my co-panelists have named, those who are most vulnerable, those who are already under state surveillance, are even more at risk as surveillance technology increases, as communication between different kinds of federal and state and local agencies increases. And so just thinking about the weaponization of digital data and how to support people to keep their own information as safe as possible. I'll give a shout out to the Privacy First Period Tracker Yuki, which has really good information about self-managed abortion and links to literally all of the organizations on this panel, and doesn't track anything, has no back end. And so and it also has an abortion finder, so you can look for abortion options, including self-managed abortion in clinics within the app without leaving a digital footprint. That's just one among many different resources that do exist. But thinking about state surveillance and state violence and the ways in which it is borne by the communities who are most at risk and already are over-policed and over-surveilled in our country is sort of how I think about the ecosystem right now.
Yes, Caitlin, thank you so much for tying those threads together. And you all have been talking so much about institutional surveillance and the institutional stigma that comes from medical providers or social service providers. And I'm wondering how communities, like our people, our loved ones, our families, reinforce that criminalization and surveillance, especially coming back to what Kanaya and Phoebe were saying about people being so highly surveilled in their own homes. So that's clearly a way that like people are reinforcing that carceral system, reinforcing that criminalization. And I'm wondering where else you all see that happening in communities and families and friend groups, loved ones.
Yeah. So, unfortunately, especially people who already have interpersonal issues or are abusive and or otherwise controlling, the abortion criminalization infrastructure is another lever that people can either pull or threaten people with. Someone who's an abortion seeker, someone who's had an abortion or having one, as well as just the overall stigma that Naran was speaking about of like thinking that something is illegal and how that permeates people's actions and ability to have an abortion safely. Um, but that also means that trying to combat that stigma is a powerful way to combat criminalization in and of itself. As well as just the information itself is such a powerful way to help people avoid criminalization. And when I say the information, I mean the information on how to take abortion pills safely is so powerful. Making sure people are taking the pills properly in a way that allows them to have a safe and complete abortion and not need to interact with these institutions where they might be criminalized. And so sharing that information about how people have a safe abortion, regardless of if they're going to a clinic or not, is so powerful, as well as, and Kanaya's touched a lot on this, but being a known safe person for people in your community to come to. Even before I was an abortion doula, once I started being an organizer for abortion access on campus, all of a sudden, like people reach out to you. It's really stigmatized. People often can't or don't know that they can go to other people in their life. And so just being publicly supportive, you don't have to have like a lot of expertise, but just having the basic information and making sure people in your life and in your community know that you're a safe person to come to allows people to avoid unsafe situations where they might be criminalized. And just having safe people to talk to who either know the information or can find it out is huge. On that note, taking basic security precautions as a practice before it's a problem. So, like using the secure messaging app Signal as a default if you're talking about abortion, if you're talking about other things that get criminalized, as this surveillance intensifies, like basic encrypted messaging. The Digital Defense Fund has a top 3 action items that we always share with folks. I'm not sure if people can see the chat. If they can, I'll drop it in there. That's really just about being like conscious of who you're talking to, using Signal, being conscious about what's put in writing online as there's like a increased surveillance state. And the other thing we can do to combat criminalization outside of just like pointed at abortion is to attack these broader systems and infrastructure of surveillance and policing. So whether that's like flock cameras coming into your city, CPS, these other mechanisms of surveillance and policing that sometimes impact abortion seekers, targeting those directly can be really powerful as well.
Ditto to everything that Phoebe just said. And I'll just add in terms of ways that communities are reinforcing criminalization in the reporting aspect digitally. A lot of the resources that Phoebe just mentioned, especially looking at the Digital Defense Fund, using like DuckDuckGo, Proton Mail, all of those things are super important. When people start sharing information about abortion on social media, all it takes is one screenshot for someone to start reporting. Also thinking, Caitlin mentioned earlier, the utilization of Yuki, because Yuki is important because there's some period tracking apps and apps that are tracking your data, apps that are tracking locations, but even more in depthly in the community aspect, when we're working with young people, we see the reporting coming from friends, coming from relatives, and that could look like parents checking their child's bathrooms and the trash cans to see if they took a pregnancy test or if they had their cycle. And we see reporting through that aspect. We see criminalization being reinforced through the spreading of misinformation, and especially within communities and colleges and different schools, there's this spreading of misinformation, and all it takes is one person to spread misinformation for it to spread. But through combating that, there's the practicing of digital safety, as Phoebe was mentioning. There's relying on people within your community. There's doula collectives that a lot of them are in different states that people, especially young people, end up reaching out to. There's abortion funds and that have like a practical support arm. There's some practical support organizations in different states as well that work to combat a lot of the stigma and misconceptions. And there's a lot of organizations that are working with people that are impacted by state violence and policing beyond just focusing on abortion, but of working with other like reproductive organizations that are focusing on supporting those impacted by state violence and policing. But it all goes back to what Phoebe was already mentioning on having and practicing digital safety, looking at the Digital Defense Fund for tips on digital safety, finding trusted members in a community, being a trusted person yourself, working with doula collectives, especially abortion doulas that may have information or may have resources that can support people, especially when they're thinking about resources to combat stigma and misconceptions and to support other people as well.
I mean, I think Phoebe and Kanaya got everything, but I think one thing I'll add is that it might feel really obvious, but it's just like remembering that these government structures are just like not working right now, and we're seeing that more than ever. So it's figuring out as a community, how do we show up and not rely on institutions like the police. Criminalization is, I think, reinforced when people don't have their needs met and their community isn't there to support them. So like figuring out what the gaps are in your community, even just as an individual. And I think we can combat criminalization on individual levels by just supporting people, humanizing people, and like really figuring out how to be a neighbor. Can a community help with mutual aid efforts for childcare while someone self-manages their abortion? Can a community come together and have like a meal train for a family so that a parent doesn't have to worry about, feeding their children while they're also, addressing their medical needs? Like, what does a family need to feel taken care of? And what can the community that family is part of do to address those needs? So for me, it just feels like combating criminalization can be as simple as just showing up for people in our lives and getting to know the people in our communities that we don't know.
I love that so much. And it's such a positive spin on the thing that I was going to say, which is that these laws are meant to isolate pregnant people who need abortions, and they're meant to instill fear in the people and the communities that surround us. And I think that taking that and flipping it on its head and really knowing that there is such strength in that kind of communal aid and support, and that is how we defeat the state violence and protect ourselves from it. I did also want to say that, as a part of our communities are healthcare workers, and criminalization has been most common in healthcare settings. And so knowing, Phoebe talked about how important it is to have information about the protocol and what to expect. And that is something that we see in all of our research across contexts. When people feel prepared, know what to expect, know that bleeding is different, but it's probably not going to just feel like a period. It is going, like really actually being honest with people about what the medication abortion experience is like can help them not need to seek unnecessary care, and also providing tools and language so that, especially in banned states, if they do need to interact with formal healthcare systems, they are prepared and can talk about their experience without necessarily sharing things that they don't want to share. I think it's also really important to like talk to healthcare providers and tell them that they do not need to talk to cops. They do not need to report their patients. As Naren said, self-managed abortion is not illegal. It is not, a lot of healthcare providers feel like as a part of their mandatory reporting requirements, they need to say something about what has happened. They don't. They're treating someone who has a medical issue. And so as in our role in this movement and in our community, making sure that the healthcare practitioners in our lives and in the communities know that and are educated as well and can be a part of that fabric of support, I think is really an important tool for combating criminalization also.
Yes, yes. And you all have already like jumped into the next question that I wanted to ask you. So part of this call is to also empower the folks in this space who are watching this call either today or in the future, watching a recording. We want to be able to empower our audience to be more supportive community members, to be a more supportive neighbor or loved one who can be the person that you call, who can be the safe person in their lives. And so from your point of view, what do we as advocates, researchers, support people, organizers, loved ones, and neighbors need to do to shift culture towards being more affirming of self-managed abortion? Anything you all haven't named yet?
Yeah. Number one thing I would say is just that it's not only a safe option, it can be the best option for a lot of people. And so, again, affirming self-managed abortion as just like a legitimate option for people to decide under their own circumstances. We talk to people in states like New York and California and Massachusetts all the time who prefer to self-manage, and it's a good option for them. And so, it's not a last resort, and it's also not an afterthought to in-clinic abortion. So many people across this country are self-managing their abortion every single day. And so for folks who are advocating or researching or anything else, SMA doesn't have to be an afterthought. It can be as taken as a given of the abortion landscape as care in a clinic and otherwise.
I agree with everything that Phoebe just said. I'll just add it's also checking internal biases when thinking about supporting someone or giving information. A lot of times people forget that they may have internal biases that may impact and spread misconception and stigma in terms of self-managed abortion. And I think another key part of educating yourselves on self-managed abortion is also uplifting the lived experiences of people that have self-managed their abortions. There's a lot of amazing self-managed abortion storytellers and advocates. We have a Youth Testify cohorts that is a collaboration between Advocates for Youth and We Testify. And we have a lot of amazing self-managed abortion storytellers that talk about their experiences and that talk about their experiences to address the misconceptions, to address the stigma, but also addressing some of the barriers to abortion access in general. And also, as Phoebe mentioned, educating people on for a lot of people, self-managed abortion is not a last resort. And it's something that a lot of people are doing and practicing in their lives, in their everyday lives. So uplifting the stories and lived experiences of people that have self-managed their own abortions, and also checking internal biases.
Yeah, and I think I would just add that just like really normalizing abortion access, normalizing abortion medication care, no matter where someone gets pills from, and recognizing that people make and come to these medical decisions because for different reasons, and just being like, just really like normalizing it, like not, I don't know, not making it a thing. I don't know how else to like really share that. Um, And also making sure that the resources are accessible to everyone so that people know, like Phoebe said, how to take abortion pills. And like what Caitlin said as well, like knowing what to expect, making sure they know who to contact if they have any medical questions, practical support, emotional support, legal support. Like when people feel informed, they will be able, I think, to like come to those decisions and the next steps in ways that can prevent criminalization. And I think in our role is making sure that that information is accessible and out there and really clear so that people can make the best decisions for themselves.
Yes to all of that. I think, as we talk about medication abortion and do that work of normalizing and talking about abortions that happen regardless of where they happen, where they start and where they end. It is fluid, and medication abortion is the same no matter what. And so I think that work of normalization is absolutely critical. And I think as we look at the media reports about abortion provision in this country, and as we think about the research that exists, so much of it continues to focus on clinician managed abortion. And I think that does a disservice to exactly what Phoebe said. Like, so many people are self-managing abortion, and it's okay that we don't have a number to point to it, but by separating it, I do think that it continues to reinforce the stigma. So I think every time we talk about abortions that are happening in this country, making sure that we're acknowledging, like, for some people, medication abortion isn't the right option. And the risks that are associated with self-managed abortion aren't right for them. And that is, people are the experts in their own lives. And I think making sure that all of the information that people have is provided in a way that then they get to make the choice that is best for them, even under constrained circumstances, and trusting that people know what is right for them, what is best for them, not censoring, not worrying that they can't handle information about what this is really going to be like, or information about the potential legal risks. Like, really just making sure that we are communicating openly, preparing people, and as much as we can, normalizing the many different ways that people need and want to access abortion care.
Great. Thank you so much for, giving folks a little bit of insight into how they can be more effective, supportive people in their communities in so many different ways. And I have one final question for you all that I believe that you're answering in the chat. So how can folks in this audience follow along with your work and get plugged in today? And I'm seeing lots of emails or lots of websites and IG profiles. Anything else you want to share, Phoebe?
Yeah. So yeah, we're on Instagram, and we have a website if folks are part of an organization that wants to partner with ReproCare or has questions. And we really do encourage you to reach out to us if you do, or follow along, refer people to us. Anyone who has a question about having an abortion is welcome to call, text, or message us on Signal. And I've said it before and I'll say it again, just affirm that everyone here can do this work. You don't have to be a professional to help people in your life and in your community have abortions. And like, you'll learn the information over time. Knowing a couple resources to point people to is all you really need. At the end of the day, the most important thing is being compassionate and non-judgmental. And that goes so, so far. And anyone can do it, and you can do it too.
Just repeat what's already been shared in the chat, but we also have an Instagram at Advocates for Youth. Also, we have a website, and on our website, we have our different programs and councils. We also have information about Youth Testify and our amazing storytellers. And if you're between the ages of 14 and 24, you can join the Youth Abortion Support Collective, where there's opportunities to connect with our regional co-leads. There's also opportunities to attend the SMA info share there, emphasizing that we're not medical professionals, but also attending the abortion support training that we have every year and also throughout the year in person and virtually. So those are a few opportunities for people to get plugged in with us. But if you're looking to partner with us or collaborate in any sort of way, you can also feel free to reach out as well.
Yeah, and if you'd like to join the If When How network, whether you're an advocate or a birth worker, an organizer, an attorney that wants to support people navigating abortion access, birth justice issues, or family policing intervention, you can fill out that form. And there are so many different ways that you can support, whether it's like legal support or supporting a young person navigating abortion access or judicial bypass, or a family that's dealing with CPS intervention or anticipates, possibly dealing with CPS at birth, and wanting to have a doula or birth worker with them at the hospital. Like, these are all different ways that you can support. So feel free to fill out that form if that feels good for you.
We are not service providers, we are researchers, but we are really happy to be resources for information, evidence, and also, for organizations that are interested in doing research. Our research is always partner driven, always community engaged, and we're really here to do work that helps improve access and prevent criminalization. And I put in the chat a summary that we recently published about the sort of history and evidence of self-managed abortion globally that I hope is a useful resource if people want to dive deep into some of the evidence.
Thank you all so much for sharing so much about your work and the ways that people can really be involved in shifting their communities to be more supportive and compassionate, and really provide the scaffolding and the support that people need in order to have really safe abortions and abortions that feel good for them, that make the most sense for them. We're gonna shift now to some audience questions, and we only have one right now. So if folks are here and you're thinking about oh, do I have a question? Please do write it in the Q&A box. I think we'll have time for a couple of questions. So if anything comes up, please do add it. But I do have one question here. And this is from Bianca in Tijuana. In your experience, have you collaborated with organizations in Mexico, either to learn abortion protocols or strategies?
I can start with that one to say that our model is explicitly based off of the work of accompaniers in other countries. Shout out to Bloodies in Tijuana. So certainly looking to the models that they've built in Mexico for networks of accompaniment and support, as well as in places like Argentina, and safe abortion hotlines in the case of our work in places like Nigeria.
Ditto to what Phoebe said. A couple years back, we did abortion activism at the U.S.-Mexico border. And as a result of that, we formulated a toolkit talking about accompaniment. And through our abortion doula trainings, we have worked with different organizations, a lot of different organizations, to formulate our abortion doula support trainings, accompaniment trainings to include information from the organizations that we have worked with. And then also we've had individuals that are abortion support individuals and do abortion accompaniment abroad as well. And that has influenced the structure and some of the information that is included in the abortion support trainings that we host throughout the year.
And I'll just chime in to say so much of the research and the models around accompaniment have been developed in Latin America. There are so many different kinds of abortion support and accompaniment groups in Mexico itself and in Latin America. And I think if whoever's asking the question is interested, I'm sure some of us would be happy to make connections if that makes sense. I just answered one question. Can I, so I shared one paper, which is sort of the summary of self-managed abortion history and evidence, and that has most, if not all, of the evidence around safety and effectiveness in it. I also shared the SAFE study paper, which is the study that I mentioned earlier. It's a multi-country study with accompaniment groups in 3 countries that definitively demonstrated that self-managed abortion is no less effective than clinician-managed abortion. But the other part of the question was, how many self-managed abortions occur annually in the US and abroad? And I just want to take a minute to say, we do not know. And I think we probably will never know. And that is a function of both measurement, and it's, you know, really hard to measure things that are hidden and stigmatized, and also, you know, because there is so much of it, and defining it is really challenging. So I think it is fair to say that it is a very large proportion of the abortions that occur annually in the US and globally, but sort of understanding actually how many is really challenging. You can take a look at statistics, for example, from India, where using various methods, they've estimated that more than 80% of abortions that happen in India are outside of clinic settings, what we would think of as self-managed through pharmacy access. That really varies depending on the setting, and I don't think that we know even a proportion right now in the United States, and things are changing so quickly. But I will point you to the 2 efforts, the We Count effort from the Society of Family Planning and the monthly abortion provision survey by the Guttmacher Institute, both of which track clinician managed abortions. And you can think about sort of that number, and then, I mean, I think it's hard to say, it might be half, it might be as many that are happening outside of clinician managed settings, but it is certainly a big proportion and not being counted in those efforts.
Yes, thank you so much, Caitlin, for taking that question and verbalizing too. I appreciate all of the resources that you all are dropping. I have another question here, and Norin, maybe you might want to take the first go at this question, but I know other folks probably have so much other information. So the question here is, are there resources, for example, know your rights, support funds, legal help, etc., for people who live in states in the US where assisting people accessing abortion care is criminalized?
Yeah, so I can actually drop the link in the chat, but If When How has a map on our website where we have the laws related to abortion access in every state. And I'll put that in the chat. And it also includes for young people under 18 what the laws are around parental consent and what that process looks like. There's also on our website some information about knowing your rights when interacting with CPS and law enforcement. And I think a really great resource for accessing information about abortion funds and practical support would be I Need an A and abortionfinder.org. Those are 2 really great comprehensive resources that have a ton of information. And if anyone has a question about their state's laws, like, please call the helpline. We're happy to help in whatever way that we can and answer any questions about bans or legal risk. But I would say start there using that map, and you can kind of navigate and click around and see different states and what the bans look like, what the limitations look like, whether there's also information about whether or not it is a crime or if there's legal risk for someone who chooses to help someone self-manage their abortion, or if it's a crime to give someone else abortion pills, because we're seeing now a ton of laws come out around criminalizing support, and that's just a way to isolate people from their communities. So we've also been tracking that in our map. And also ReproCare is an amazing resource.
Yep, I was actually going to throw it to you, Phoebe, if you have any additional, I don't know, support information for folks on the call.
Yeah, I feel like for that question about legal support, if, when, how, and all the like sub resources there are so valuable, that resource is there. You know, I think one thing is that these laws intentionally isolate us and make us feel like we have to bear the full weight of surveillance and criminalization from the state alone, but we don't. There's infrastructure and support for people who are helping and sharing information. So that's the main thing I'd say is like the emotional element of it. And again, we're always here to support and share information as like a national organization, sharing publicly available information and having that sort of institutional support as well.
All right, that was our last question. If folks don't have any more questions, I'd like to go ahead and close us out by thanking our panelists for being with us today and teaching us so many new things. I learned new things today, and for doing a little bit of support and empowering us to being more supportive and trusted community members, neighbors, loved ones, friends, family. Um, I want to just kind of close us out by referring back to those things that our panelists named as ways that you can get involved with the work that they do. We shared a long list of links and social media accounts and all of those things. Shout out to my team for transferring from just panelists to the entire group. And we have an email going out at the end of this week, which is kind of like a recap email of this. You're going to have some additional political education, and you will also have access to this recording forever. It's going to be on our website too. So I also just want to like call folks' attention back to some of the trainings that were named. Advocates for Youth named some trainings that they hold centering self-managed abortion and youth specifically. Abortion on Our Own Terms is an organization that also does trainings on self-managed abortion, and self-managed abortion safe and supported, we call them SAS. They also do some trainings like really kind of around like protocols and things like that. So I encourage you to familiarize yourself with those organizations and look them up. We will have links to all of the organizations that would be helpful in supporting you all in being the most supportive community members that you can be. All right. Thank you all so much for being here. Thank you, Kanaya, Phoebe, Nora, and Caitlin for being here. Thank you so much to my NNAF staff team for supporting with this space. I hope you all have a really wonderful evening and you do something that that you like to do to take care of yourself.
Thank you all.
Thank you.
Bye. Good night.